Welcome to the Operation Advocacy podcast, improving the lives of children through simple conversations, a podcast produced by pediatric surgeons. Participants in this podcast are not speaking on behalf of any organization, society, or institution with which they may be affiliated. Comments and views shared are independently their own.
I am Dr. Joanne Baerg, a pediatric surgeon and injury prevention advocate. I will be hosting today's podcast, E-Bike Advocacy, Kids and the Speed of Change. I'm thrilled to be joined today by Dr. Sigrid Burruss and Dr. Romeo Ignacio. Both guests are leaders in e-bike advocacy. Dr. Ignacio is a pediatric surgeon in San Diego and a member of the Imperial County chapter of the American College of Surgeons. Dr. Burruss chairs the Advocacy and Health Policy Committee of the Southern California chapter of the American College of Surgeons. For her work, Dr. Burruss was chosen as the 2026 ACS Advocate of the Year. Dr. Ignacio, can you tell us a little bit about yourself and how you became interested in e-bike advocacy?
So first, Joanne, thanks again for inviting us. It's obviously a pleasure to share a topic that both of us are very passionate about. I think I got involved with this topic back in 2021 when I ended up seeing just only 3 e-bike injuries. And at that time, the injuries were just much more severe than we had seen in previous years. We just had gone over the e-scooter injuries that had just sort of subsided. But with the e-bikes, I was concerned that this was going to be a potential problem. And unfortunately, I was right. And after that, I just started to collaborate with many other individuals who were passionate about this topic. And one of them is Dr. Burruss. And so we have worked together along with other organizations, societies, various stakeholders, and really want to make a big difference in making lives safer for children who use e-bikes. But that's how I was involved.
Dr. Burruss, can you tell us how you became interested in this advocacy topic?
Yeah, absolutely. Thank you for having us. This is one of those issues that's becoming more and more prevalent. And, as Dr. Ignacio mentioned, a few years ago, we really didn't see any e-bike injuries. And then they started to trickle in, and now it's a daily occurrence. And so when speaking with patients about their e-bikes and why they have them, what training they've had, we really identified a lack of understanding as to what e-bikes are and the injuries that are associated with them. And that's how I got involved with the advocacy work that Dr. Ignacio and many others are working on as well.
So, Dr. Burruss, in addition to being interested in e-bikes as a trauma critical care surgeon, you are also a mom. And when we were preparing for this podcast, you indicated that you had purchased an e-bike for your child. Can you share your story about this?
Absolutely. The e-bikes in general is something that can be used safely if we understand the risks associated with them. So just like when purchasing any other item for your child, I think parents have to have a really good understanding of what we're getting. And in my work as a trauma surgeon and already seeing these e-bike injuries, I had some understanding of what the risks were in terms of getting an e-bike. And when my son brought up wanting to get an e-bike, it was really because all of his friends have one, right? So he wanted to keep up with them on their bike rides as they were heading into the summer. And this was between 7th and 8th grade. So he would have been 13 and a half years old. And so, in trying to understand why he wanted an e-bike, what the purpose was, and also discussing the risks of it, it landed on getting a Class 1 e-bike so that he would still get exercise. He still had a pedal, but he would be able to keep up with his friends on the bike trail. And then also had him take an e-bike safety course to really make sure that he fully understands the rules of the roads. And that all is built on having ridden bikes together for many, many years. So conventional bicycle, riding to the park on the bike trails, and knowing that he understands the rules of the road. He knows to be aware of the traffic around him. He's been very consistent with his helmet use. And so, although some things are unpredictable, I felt very confident that he would be safe on his Class 1 e-bike.
Thank you for explaining all that. You both mentioned that you became interested in the topic because the rate of injury appeared to be increasing. So let's talk about those numbers. Can either of you speak to what the data shows about e-bike injuries, fatalities? What really is the scope of the problem right now in 2026?
Yeah, I think when looking locally, I'm talking about the children's hospitals. You know, Dr. Laura Goodman is the trauma medical director at the Children's Hospital of Orange County, is our sister hospital for Rady Children's Health. And we looked at both of our numbers, and it is now e-bikes are the number one cause for trauma activations in Orange County. For us last year, it was number two, but the way the numbers are, we're seeing, we saw over 90 the first 3 months here at Rady Children's Health San Diego. It will also be a number one cause for trauma activations. And much of these injuries require, ER services, trauma surgeon services, operative services, and even ICU care. We also did a study looking at the national numbers, and we did a retrospective cross-sectional study through the National Electronic Injury Surveillance System. And we looked at the years between 2019 and 2023, and in those years there was over 15,000 pediatric patients that were related to e-bikes. Majority of them were male, about 80%. And if you look over that 5-year period, I think there was an interesting trend. The initial year, it was only 4% of those cases were in 2019. In the last year, it was 50%. And what we're seeing is a doubling of the number every year and a half. So it's no longer a niche type of injury. It's a rapidly growing public health issue, especially among our teenagers.
Those numbers indicate a real burden on our hospital system and something that we all need to be aware and pay attention to.
And I think when you ask me about the injuries, another study we did looked at those injuries, and majority of them are related to speed or obviously not obeying the traffic rules of the road. And if you compare that to the conventional non-motorized bicycles, we see a higher incidence of head, neck, or facial injuries. If you compare, it's about 50% of those we see in the study. And there was a great proportion of children with speed-related injuries to organ injuries. And I don't see that here in San Diego. Almost a quarter, 24%, end up being admitted because of their internal organ injuries. And so that shows you the speed, acceleration, and probably a lack of experience that have led to many of these injuries that we don't typically see for the non-motorized bicycles. These are basically injuries that we see with motorcycle type vehicles.
So let me just reflect back to what I think I hear you saying. If children would slow down when they ride their e-bikes, wear their helmets, obey the rules, and possibly if we had age limits, some of these injuries would decrease.
Yeah, absolutely. Just from those first three things that you mentioned, just going slow, being safe, and making sure you're aware of your surroundings. And I think having consistent rules. I mean, most of the rules that we're seeing, they don't only differ between states, but within states. Here in California, if I go from here or Orange County or up at San Francisco's, the rules for e-bikes are much different. And I think if we have consistent rules and consistent regulation, I think that would bring safer environments for our children.
So talking about rules and regulations, you both took your passion for injury prevention from the trauma bay to the offices of legislators and your interest in improving the rules that children would have to follow. So you both worked together in California for policy changes. Can you talk about your approach and where you succeeded, and also why do you think you succeeded?
There's a few things to highlight, and this is certainly a long process. So I think that the first thing is it takes time, right, to really engage with legislators and even highlight the problems. So discussing the numbers in terms of e-bike crashes and injuries and potentially underlying reasons as well, which is sometimes difficult to gather that level of granularity. But in addition to the numbers, I mean, what we really have access to is our patient stories, right? So those patients that come in after e-bike crashes that are admitted to the ICU for traumatic brain injury, the ones that come in with severe facial fractures requiring surgery, right? Those are those stories that really capture the attention of us, right? That as having severe injuries requiring hospitalizations and really long-term care after discharge as well. And that's also what can really engage legislators, is to hear from patients about their experiences. And that's then how we can start talking about policies that will help protect our communities.
Dr. Burruss, do you have any specific stories where you shared a patient story with a legislature, and you started to see change?
Yeah, and this has been incremental. And so, starting at the city level, even here in Irvine, where I live, being able to meet with some of our council members and share data and stories at meetings, to be able to again engage them at the city level. But as was mentioned, right, we now have legislation that differs from city to city and county to county, which can make it very difficult for an e-bike user to know what's lawful or not lawful, and then taking that to the state level. And so really coordinating a lot of these efforts with other organizations, including the California Medical Association, and being able to draft legislation looking at e-bike safety. So there's quite a few bills currently going through the committees, some which have already been defeated, but a few others that are, hopefully we'll get passed, because they're quite excellent. I think we'll be able to reduce the burden of injuries and death.
Yes, I also participate in your Southern California chapter meetings, so I am aware that we did discuss that some of these e-bike bills were defeated. Can you tell me, how do you think we should push back when bills are defeated?
Yeah, one of the challenges is coordinating a lot of these bills. A lot of them come at it from different angles. So, one of the ones that was defeated was going to ask e-bike users to use a license plate, which makes sense. But when we look at the big picture problem, and also the burden that may get placed on lawful e-bike users and the cost of it, those are all things that need to be considered as well as we think about legislation. And so ones that will be effective and feasible are really the crucial ones to follow. And so, current ones looking at having education available about e-bike safety in the schools, right? That is something that's feasible and effective. Having speed limits in place as well, or requiring helmets, those are going to also be feasible and effective. And so, and trying to engage with all of the stakeholders as well, I think is really helpful to help get this legislation through.
Yes, when we were preparing for this podcast, we talked about collaborations with all of our state ACS committees. We talked about American Academy of Pediatrics collaboration, also the National Traffic Safety Association, and collaboration with law enforcement. Dr. Ignacio, can you expand on any of those organizations and what has been an impactful collaboration?
Sigrid says it best, collaborating with key stakeholders. I think as pediatric surgeons, we're so comfortable in our little world that we live in. But the reality, though, is when it comes to advocacy, there's a lot of individuals that share that same passion. And I think it's valuable to hear their perspective, hearing the perspective from parents, from community stakeholders. And most recently, the one I'd like to talk about is law enforcement and some of the prosecution that's happening in relation to some of these unfortunate incidents we're seeing here in California. I attended the Office of Traffic Safety conference this past week, and having a room of law enforcement and hearing the challenges that they face with e-bikes. In many instances, many people don't know, but they have been tasked with the problems that they see with e-bikes, with all the injuries that they're seeing, some of the reckless behavior that's going with e-bikes and e-motos, yet they're told not to chase them. So they're saying, well, how can we prevent a problem if we can't intervene? And if we intervene and something bad happens to a child, they're in trouble. And so they also see that sharp increase of unsafe ride behaviors, but at the same time, they're sort of looking for guidance in legislation and how do we make it safer for kids? Because, when kids are riding on these bicycles at these high speeds, they are not being told or educated on how to do it. So one of the things they did, I applaud Sigrid at where she's at Orange County on Huntington Beach. The law enforcement has tried to intervene in a very positive way by having these modules and educational rodeos where they invite kids to know what the e-bike is, what's a class 1, 2, or 3, what is the safety equipment, what are the rules of the road, and they actually will take a test. And I think that's a great way of how law enforcement is intervening, because yes, they can't chase the individuals, but they can make a big difference in those individuals who are purchasing a bike or thinking about doing it. The other aspect I thought was interesting was they have seen unfortunate deaths from either unfortunate kids who get injured from these bicycle injuries, or a bicyclist who runs into a individual. And we had 2 deaths in Southern California, and now they are telling parents, if you had been warned about your child riding a bicycle and yet they persist and it leads to the injury or death of an individual, they are prosecuting those parents because they feel that these are not toys. These are motorized vehicles. And I think that's worth saying again. These are motorized vehicles, and if you have been told about the rules of the road and you've been told your unsafe behavior, yet you continue to do that, that's considered a felony. And I think, right now we're in this evolution of what was going to happen with some of these cases, but I think they're really trying to make a message to the public that e-bikes need to be regulated. We need to have safer rules, safer laws, and a way for us to change the culture. And they said it so many times in that conference, we have to change the culture. These are not bicycles. These are motorized vehicles. And until we change that culture, we're going to consistently see all these injuries. And I really valued their opinion and some of the things they shared with me at that conference. It was very powerful for me to see that.
Yeah, and thank you for sharing that on this podcast, because I think that information is probably not well known, and many pediatric surgeons and other professionals would not be aware that that is the point of view of law enforcement. And certainly there's a lot of opportunities there for us to partner and to educate and promote some of this information from law enforcement. As you were mentioning, sometimes we can just emphasize data and we repeat numbers in an echo chamber. And that's what one of our goals of the podcast is, to get out of that echo chamber, learn about what other groups in our that have similar interests to us, which is keeping kids safe, and what they're doing, what they're saying, so that we can amplify the message.
Yeah, they play such a critical role because, instead of catching people in the act, what they're trying to do is just reinforce those behaviors, the ones that you talked about with helmet use and making sure there's not more than one passenger if it's not appropriate for having more than one passenger. They're also, they're engaged in the community, and they're having targeted enforcement. We're seeing that here in San Diego. You're having a bunch of rules, but there's no enforcement, and these things are going to be happening. So, but I do think one thing they're asking the legislation is for clearer laws, community backing, and a way to enforce it where they're not necessarily being the bad guy. They're trying to provide a safe environment for children. And the one thing they told me, I asked them, well, why'd you invite me to come? They said, because we want to see what you guys are seeing. And if cops are seeing the injuries that children are getting, that means they're not doing their job. And so they want to do their job so that us doctors don't keep treating kids with these bad injuries.
Definitely. So here is another important point that our listeners may not be aware of, and you touched on it very early on when you mentioned that you had done some research with the National Electronic Injury Surveillance System. So e-bikes are regulated under the Consumer Product Safety Commission, and the injuries are reported to the NEISS, or National Electronic Injury Surveillance System. Policies, which we all need to be safe, and which you stated law enforcement is also seeking, policies are recommended based on collection of this data. So many of our listeners may not be aware that the CPSC and NEISS has existed since 1972, but these entities are undergoing significant defunding. Our colleagues in the AAP have been quite active in trying to put out statements to legislators that the CPSC must be maintained and must be supported. Either of you can answer this, but how critical do you think this injury surveillance system? What else can we do to oppose the defunding?
The CPSC has traditionally been tasked with developing and enforcing, product safety standards, helping facilitate recalls, and also responsible for educating consumers and businesses about potential hazards. And so, all of that is informed by the National Electronic Injury Surveillance System, right, that collects data on consumer product related injuries throughout the U.S. And that data, includes lots of things, including the number of injuries, right? This is one of the ways that we just saw this dramatic rise in e-bike injuries across the U.S., looking at incidents of ED visits, hospitalizations, injury patterns, helmet use, age distribution, and many, many other variables. And so that data, again, that's collected from across the U.S. is really crucial for informing all of us and the CPSC to help keep consumers aware and safe. And so with this, proposed defunding and potentially even elimination of CPSC, whose functions would then be absorbed into the Department of Health and Human Services, that's going to be really detrimental, I think, to consumers across the U.S., right? Because we're not going to be able to understand what those injury trends are over time, who the high-risk groups are, and then use that information to make e-bikes safer for consumer use. And so I think we're going to have some significant struggles in terms of keeping e-bike riders safe if we lose this data collection system and enforcement.
As physicians, we are very data-driven, right? So having these systems is absolutely foundational. I mean, it's like Sigrid said, they're vital for us to making determinations. And when we're talking about even making policies like helmet recommendations and age limits and safety campaigns, we can't do that if we don't know the patterns through the surveillance data. And so I honestly think when we see this, now we're seeing it right now, right? So when funding is cut, we're going to lose the ability to see those early warning signals for emergency injury trends, right? We're going to lose the ability to measure how policies are working. If we make a policy, is it making a difference in e-bike injuries? And so if we're making decisions on anecdotal data, that's going to lead to a lot of confusion. So in practical terms, that means that if we want to catch these injuries early or at least prevent them, we need to recognize it. And I think we're already past that, right? We, like I mentioned back in 2021, when we saw a few injuries then, it is now essentially a huge public issue among children. And so without the data, we can't really make any changes and stuff. So I think it's important for individuals to understand that if we can't measure these injuries, we can't prevent them. And such defunding of surveillance systems like the CPSC and, the NESS, it puts us at risk for, reacting too late. And so I think that, Sigrid says it best, and it's very vital for us to have these systems.
Yes, I agree 100%. I mean, we actually have been quite fortunate to have a very well developed injury surveillance, like a canary in the coal mine, really, that's existed for injuries. It's functioned well since 1972. I would like our listeners and the public all to be aware that, if we're going to support something, I think for all of our safety and our children's safety, we need to support the NEISS. But pivoting over to a couple other topics that I wanted to talk with you both about. We talked about how you've both worked with the legislators in California. We've talked about some of the bills that have passed, some of the bills that have not passed. But a very important bill that is quite timely is the Safe Ride Act. And this is a federal bill. And I don't believe that it speaks so much to actual rules, but more to the aspects of public health and education. Would either of you like to comment on why the Safe Ride Act is important and how we can support it?
Yeah, the Safe Ride Act, which is also known as HR 5265, is an important federally funded effort. It's by Representative Gottheimer from New Jersey, and it's currently being introduced in Congress, but I think it's being tabled and hopefully will be reintroduced for next year. I think at its core, this bill is trying to do something that's being missed, which is creating a national framework for e-bike safety rather than the patchwork that state by state does. And so I think what it does is it focuses on three key areas. One, it gives funding and incentives. It allows for federal grants for states that implement strong e-bike safety programs, things like we talked about, helmet laws, enforcement, education, and so forth. Number two, it emphasizes education prevention. It mandates the development of national safety curricula, teaching riders, especially adolescents, young kids, about the safe use and helmet practices. And then it wants to also discuss about, it also emphasizes guidelines for implementation, data, and accountability. Going back to again about using data to drive us to have better policies and to see if those policies work. So I think those are the areas that it emphasizes now. Unfortunately, it's being sort of tabled until next year, but I think this is one of the key steps from a federal standpoint for e-bikes. And realize, 5 years ago, no one talked about this, and now I think every state is talking about this. So I think this is the step in the right direction, and it's not trying to, get into the granularity, but trying to support states who want to do e-bike safety and public awareness.
Great explanation. Just a couple questions now as we're coming around to wrapping up our discussion. My first question is going to be focused on our colleagues. So if our colleagues in pediatric surgery do not have a lot of time, but they were listening and they wanted to know what can they do to support e-bike advocacy, can you give some suggestions of what you would like them to do?
Just a few things. When people are looking to educate themselves, I think there's some really good options available through both the Southern California ACS Advocacy website that has some flyers that we utilize that provide information as well as links to the additional educational opportunities, including the California Highway Patrol e-bike education module that is available and free for everyone to use, that I think provides a really good outline of what e-bikes are and what the concerns are with them. Other things to think about, helmet use really for all of us is crucial, both in the pediatric and adult population. And just because they're not required for adults, I think having adults model helmet use as safe e-bike use is crucial for our kids to then follow in our example, because we know that helmets certainly are protective and much more so even with the electric bicycles that are a higher speed, in which we've seen a higher incidence of severe traumatic brain injuries. So I think it's just educating ourselves about e-bike safety and being able to relay that in a reliable manner to our youth and parents that we take care of.
That's great. And we will attach some of those resources to this podcast with links so our listeners can explore them a little bit more. What would be your take-home message, Dr. Ignacio, about e-bikes?
I think it depends on who's your audience. I think Sigrid had highlighted some of those key points. If you're talking to a parent, I think that when I see parents in the trauma bay who see their child injured, I think the most common statement I hear is they just say, I didn't know. They feel so guilty. They bought this bicycle they thought was just a bicycle, and now they see their kid with a head injury or a spine fracture or a spleen or a liver injury, and they feel unbelievably guilty, and they all say, I wish I knew. And so I tell parents, number one, that e-bikes are not just bicycles. They are truly motorized vehicles. You would not put your young child on a motorcycle, and these are getting to those speeds. Interestingly, we talk about teenagers, but, for me, the youngest age I've seen for e-bikes is 4 and 5. And the industry has made e-bikes for that young age group, and I think everyone has this false sense when we say e-bicycle, they think it's just another toy, but these are not toys. And number two is that you would, if there was someone on a motorized vehicle, you would want to make sure they're safe. So helmet every ride, making sure they're not only wearing it appropriately, but depending upon the type of bicycle or e-bike, you want to make sure you have the right helmet. For like class 3 bikes that go up to 20 miles per hour, wearing those other helmets are not going to work. You have to wear one that has the ability to take that kinetic energy, one that protects the face and the jaw area. So it's basically a motorcycle helmet. And then 2 is to make sure that they know the rules of the road, that they're not riding distracted. And so that has to be a really serious discussion that parents need to have with their child. Unfortunately, that discussion is a little bit too late when they're in a trauma bay, because although e-bikes offer the freedom and fun that kids want, we have to provide those safeguards because they carry serious risk. And our job is to making sure that families understand that these injuries can happen, and having those discussions after the fact doesn't work. On the flip side, though, if my audience is to pediatric surgeons, clinicians, we are at the front lines of injury patterns, and we are a well-respected opinion within the community. And so when people are asking our advice, we should give them that advice that is balanced, right? If we are the type of surgeons that says we should ban all e-bikes, well, that discussion is going to be very short. But if I think we weigh the risk benefits as well as providing that education, that prevention, then every counter is an opportunity to counsel families and push for safer practices and a voice for policy that reflects what we're seeing clinically. I think that's a good way to approach it. And these are things I honestly have learned from Sigrid over the past few years. And so I think it depends upon my audience, but that would be the take-home message that I would like for people to hear about.
Dr. Burruss?
Yeah, I absolutely agree with what Romeo said. And, I think when we look at the bills, too, that have continued to make their way through committees, especially here in California, we see that in terms of how they've engaged with all providers in healthcare, the industry as well, right? Because it really takes all of us to be able to reduce injuries. And so manufacturers, distributors, and sellers all need to be involved as well, because they do have a very powerful lobby. And so if they're not engaged, it's tough to get some of these bills through. Even if they will reduce injuries, it's just going to be tough to get it through committees. So when we look at, say, in California, AB 2346, that is written to require e-bikes to have speedometers, to establish speed limits, make sure that those that are 16 and under ride with speeds less than 15 miles an hour, or the bill from Senator Blakespear, SB 1167, that really differentiates between legal e-bikes as defined by CPSC and those that are outside of those definitions. So they are not e-bikes, but e-mopeds or e-motorcycles, and should be regulated motor vehicles. Those, I think are all, again, going to be very effective in reducing injuries and really allowing consumers to know what they're purchasing, right? Is this an e-bike, or does this have a motor wattage above 750 and is not an e-bike? And that needs to be clearly labeled, because otherwise it's seen as false advertising by the manufacturer or seller, and that is a crime, and they will be prosecuted for it. So I think lots of ways to address the problem and really allow consumers to have the information that they need when purchasing an e-bike, and also allow providers the information needed to discuss these in the office, in the trauma bay, or wherever else with parents and youth.
Thank you, Dr. Ignacio and Dr. Burruss. I think we have a very informative podcast, and I want to thank both of you for giving your time to talk to me today. We will wrap it up here. This is Operation Advocacy. Thank you.
Thanks for listening. Make a difference in the life of a child. Advocate, but also please like and subscribe to our podcast. And if you want to make your voice heard, one way to do that is contacting your policymakers. There are some links below that can help.